anytime a caregiver has friction or a problem or an overwhelming feeling, like to really think about, is there a way that a system or technology can help ease that in some way?
In this episode of the AgeTech podcast, I talked to Elizabeth Miller from Happy Healthy Caregiver about real tech solutions that make caregiving easier, more human, and less overwhelming. Elizabeth, welcome to the show.
Thank you so much for having me.
So, could you tell us a little bit about your origin story and what got you started with Happy Healthy Caregiver?
Yeah, very fitting that we're talking today because today is my 4-year anniversary of doing my business full time. But I have started Happy Healthy Caregiver 10 years ago because I felt invisible, frankly, as a family caregiver in this space, was caring for my parents who had chronic comorbidities. My husband was simultaneously caring for his mom. We were working and in the peak of our career earning years and raising middle schoolers at the time, and just felt like, why is this so hard? And can we clone ourselves so that we can get more help and support? I felt like people were shoulding, I call it, on me, Karen, about like, oh, you should be doing this and that for your loved one, but really felt invisible, that my own health and happiness was suffering in this process and like nobody was seeing it.
Wow, that is such a great motivation to start advocating and working with other caregivers to provide them the support that honestly they so desperately need. Mm-hmm. So when you reached out to me, you and I wanted to talk about like the intersection of technology and caregiving, which is one of the areas that I'm super excited about in this day and age. I wonder, like, first of all, as a family caregiver, what has been your experience with technology? Have you personally used any technology to support you and your family in your caregiving journey? And what have you seen that other caregivers are using and what works for them?
Yeah. There's a lot. I think to kind of understand too the context of where I'm coming from, it's important to note that my professional background before I became an entrepreneur full time was that I worked in IT. So I was a product manager, project manager, business analyst, always kind of looking for the ways to solve business problems using technology. So now I'm in this caregiving space, and there's 53 million family caregivers just in the US alone. We've got so many more, globally, and we are outnumbered. And I felt like I can't be doing all of the things that people need me to do. So there's a lot of pain points that family caregivers have. And a couple of the top ones is that they need help, right? They need help with the task coordination. They need education because I'm not a nurse, I'm not a social worker, and all of the things that are kind of being thrown at me, I am learning on the job in a very crisis sometimes situation, in a very emotionally charged situation. And then we also need help with finances because care is super expensive. And I think that's one of the things that we realize when we get into this is like, oh, some of these government services that we thought were going to help us aren't necessarily, the answer for everything. So I learned very quickly that I was in a role with my caregiving life that was not going to be sustainable had I not figured out how to put systems in place and how to use technology to help bridge this gap of being outnumbered, which is only going to continue, as you know, getting worse for people as we get more and more outnumbered. Some of the ways that we used it in my family, and most of my care journey was helping to care for my mom, and she was bedridden the last few years of her life. My dad passed away 6 years earlier than my mom. We would have thought my mom, sadly was going to go before my dad. And so we really were struggling to figure she had a high level of care needs. Thankfully, my mom was open to using technology. So her iPad was her lifeline to the rest of the world. Some of the things that we did were in our hospitalization journeys with my parents. I'm from a very big family. And one of the big roles as a family caregiver is keeping everybody informed, and it can be exhausting, all of the questions and the updates and everything. So we used an online journal called caringbridge.org that helped post these updates and have this two-way communication. People could post pictures and memories. And, when my dad was really sick and my mom couldn't even go to visit my dad because of her health concerns, it became a way for them to kind of share and write and do things other than using the phone. So that was a big thing. And then when my mom became bedridden, her world got so much smaller. She's on a hospital bed. And so we were trying to use different things there. She loved to do puzzles, but didn't have the table space to do that. So we did digital puzzles. She wrote books about animals. And so we would find YouTube videos about animals so that she could kind of watch and access the outside world through that. And of course, it was essential for my family members to have a way to communicate with her. And she used FaceTime. We would joke that we would not get her whole face, in the image. I'd be like, Mom, I can't see you. Your napkin's over the camera, or whatever. But good for her, right? To keep trying up and show it. So some of it is not like, the groundbreaking technology that we're seeing today, but I think this is real, ways that caregivers are using technology. Another way was to, using the reminders on our phone. Like sometimes you're deep in something, in a task. And so and I'm almost afraid to say it because my phone's going to start talking to me, but asking for reminders about scheduling appointments and the things that are on your brain, like while you're in the midst of doing something, or ordering supplies, like while you're using them, you're realizing you're out of them. So those were a few of the things that we did. Another kind of no-brainer thing was setting the coffee pot timer. So the coffee was going to be made so that we could hit the ground running in the morning.
Absolutely. And you know what? I always say that it's not about the technology. It's about what the technology does and what it allows you to do and how it improves your lives or reduces some of the burden that you have to carry as a family caregiver. And yeah, it could be something as simple as FaceTime on an iPad, or reminders on your phone, or a timer on your coffee kettle. It doesn't necessarily have to have virtual reality, AI, computer vision, LLM.
Yeah, to be the coolest thing
embedded in
ever.
it.
Because sometimes those can be barriers, right? Like I'm not sure that my mom would have completely embraced some of those things. I do think like she had a baby doll, and I think, now that I know about like Joy for All Pets, I think she could have really enjoyed something a little more animated because she was a mom for 6 kids. And so that was a comfort to her to have that. So there's a lot of things that we as caregivers, and as I am a coach for family caregivers and an educator now for them, that I want to remind them to think outside the box. And caregivers are super creative, but we immediately think about asking for help from our family members. But there's a lot of help out there beyond family as far as human beings, but also using technology through Amazon Subscribe and Save or Instacart. As a working family caregiver, my mom would be out of incontinence supplies, and Instacart could be there before I could be there. And what a load of stress that took off of me, especially if I had a critical meeting that day. And, I think anytime a caregiver has a problem, and you mentioned the timer, and I thought of another story too, where one of our resistant things with my mom is that she had COPD and she used to have to wear a nebulizer at certain times of day. And she used to always fight with us about, it's been 10 minutes, it's been 10 minutes. And like the simple thing of using her iPad and setting the timer for 10 minutes and saying, this is 10 minutes. And when this goes off, you can take the mask off. Like that reduced so many fights for us and was really, really a boundary. But anytime a caregiver has friction or a problem or an overwhelming feeling, to really think about, is there a way that a system or technology can help ease that in some way?
Absolutely. And I think this is something, you touch upon something really important. I mean, with your background, it was obvious that you would go and look for tech to help you with your caregiving. However, for many people, because they don't know what they don't know, they don't even know that these solutions exist. So they don't know to go look for them. And like you said, you're in a crisis mode. You're trying to figure out what you need to do and how to accomplish it in the most effective way, in the best way for your older loved one. You don't necessarily have the bandwidth to go and find technology and do your market research and figure out which solution is the best, and then go buy it and go teach yourself how to use it, teach your parent how to use it. So what advice do you have for, first of all, for startups to bridge this gap and to meet caregivers where they are? And that's one question. And the other question I have is like, what advice do you give caregivers with everything else they have on their plate
Yeah.
to go look for solutions?
Yeah, I think organically, the simple answer for the caregiver is the best ideas in my mind come from other family caregivers. Like you are going to get the tried and true tips, the real stuff. And I do that through my podcast of spotlighting real family caregivers, sharing the resources and the things that have worked for them. Because that's important. I think we're looking for creative solutions. So some of it is just tapping into these communities like mine that exist, these support groups, because whatever you're going to come up with, somebody may have a potential idea or resource or solution to be able to help you with that. And so plugging yourselves into these communities, whether you're doing it virtually or in person, or even subscribing to an email list or listening to a podcast, like that's something that you can do that's going to benefit you in a lot of different ways, because we need that connection and we need that community anyway. And so you're going to be getting the education and the resources as a side benefit to that, which is going to have a lot of lasting benefits for you. For the people who are creating the solutions, and I'm so grateful and I love it. And a lot of these people are caregivers, right? They've seen this problem and they're inventing a new way of doing things. What they're doing is creating amazing products and services to help people. And they've got this fabulous thing out there, but they don't have a way to amplify it and elevate it into a family caregiver community. So one of the ways that I didn't know that I was going to make a living when I started my business is I call myself an accidental influencer, where people have been, because I have built this trusted community, it's a win-win for them to potentially advertise on my podcast or advertise in my newsletter, or maybe hire me, as some companies have done, where I've done intense product reviews, where I'm literally unboxing things and I'm not afraid of technology. And I've built trust with these folks who are following me. And so trying them out and testing them and showing them exactly how the thing is going to remove some of the fear and some of the barriers around that, and really kind of fast track them to the resources that can help them, because it is such a situational thing where you have a specific problem. Maybe your problem is medication management and your person doesn't live with you. And how are you going to feel confident that they are taking their meds every day? Well, there are products out there that you can, will tell you if they've opened their pill box, or will dispense it when they, hit a button and track it and send you alerts as a caregiver. And a lot of that is, I still call it self-care for caregivers, because it's going to provide you peace of mind and provide you, that more mental health capacity to do other things that are going to energize you. But there's a lot of cool stuff that I think is being out there. And so I'm trying, as a person who's in this care economy space and wants to fast track caregivers to the resources that can help them, it's a responsibility of mine that I stay kind of abreast of everything that's going on. And that's why I love your newsletter in particular, is it really gives me that information in bite-sized ways.
Thank you. I appreciate it. So you mentioned that you do some collaborations with startup to help get the word out there to the caregiver community. What has been some of the feedback that you received from the caregiving community in terms of what are the challenges people are dealing with, but they can't find solution? Like are people emailing you saying, Elizabeth, I need this solution. I asked the community, it doesn't exist. Can you talk to the startups and tell them to build it for me?
I think they don't necessarily phrase it like that, because, to your point earlier, they don't know what they don't know, right? It's coming up more as a problem. When I'm coaching or I'm in a virtual support group session or I'm speaking to groups of caregivers, it's usually coming up like, I can't get my family members to help me. How can I, what can I do to make this happen? And maybe it's educating them about certain caregiving apps being out there where they can create a team and they can invite people to, so-and-so has a doctor appointment. I'm looking for help here. Or, what is your availability on, I need to schedule an upcoming appointment, and putting all of that stuff in one place. Or it comes up like, I'm not able to know if my parents are taking their meds, or I feel like my loved one is depressed and they need more socialization. And so those are the kinds of problems then that when they're working with a community or a coach or a group, that then solutions can start to open up. My folks are sadly now deceased, but I'm still a caregiver for my brother, and I share the care with my siblings with him. And he was born with an intellectual disability and is on the autism spectrum. He literally was talking to me yesterday after an appointment that he's a 62-year-old guy. He wants to date. So putting him on a typical neurotypical dating site is not going to be successful for him. So now I'm thinking, I got to find a solution. Maybe it's out there. Maybe it needs to be created, but a way for my brother to safely date other people. And another thing that we're dealing with as a family is he has a social disability. So as family caregivers, we need to monitor social media, and he has repetitive behavior. And so he can message someone too much. Like, is there a way that we can put limits on his Facebook Messenger so that people aren't getting frustrated and blocking him with repetitive phone calls or repetitive messages? There's a lot of work to be done, and there's a lot of problems that we have to solve. There's so many problems to solve, like new ones coming up every single day that will never be bored. There's a lot of technology that can help people out there.
What do you see as sort of the biggest problems that no one is currently solving?
Well, if asking me as a business owner of Happy Healthy Caregiver, like one of my frustrations that has been my frustration since day one is that we are not fast tracking caregivers to the support that we need. Like, think about the people who are going in with their loved ones to a hospital environment or a doctor's office. We see a lot of ads and information about prescriptions and things like that, but there's nothing there to armor up this family caregiver whose life has completely changed. Like, when a loved one gets a diagnosis, we are also getting a diagnosis where life is different as we know it. And so if I could wave my magic wand, what I would want to be true is that when I was by the bedside at those hospital environments, or when I'm sitting in the waiting rooms of those doctors' offices, that support and resources and education is right in my face. So maybe it looks like clicking, instead of watching HGTV or the Food Network, there's a channel of education and support for family caregivers there. Maybe it is a simple resource sheet of here is support in your area. But to me, the natural gateway for that is in our healthcare environments, and I'm just not seeing that there. And as a business owner, it is difficult to kind of break into those areas. I jokingly kind of call them mini government in a way, because they kind of just stay within their own, and they think maybe that they're doing that. Like, well, we have case managers, we have family patient advocates. I'm like, no, that is not the same thing. We need it very accessible for people, because again, they don't even know to come and ask for that person and to ask them those questions.
Absolutely. There are startups who make some of the information accessible. However, I believe the large language models could really be a game changer here, because you could potentially just start a conversation with ChatGPT and say, hey, I'm a family caregiver. My mother was diagnosed with X. I live in this zip code. She has this insurance. What do I do? And it could quickly educate you if it had the data, which probably right now it doesn't, but the government has the data, the insurance companies have the data, the health systems have the data. So it's only a matter of aggregating it. It's not even it shouldn't be something that's regulated. It's public information.
Why is it so hard? That's kind of goes back to the question. We have where I am, my chart information keeps track of all my test results and the doctor's appointments, and I can do my forms and stuff. How are you? How is your mental health? What are you doing to support yourself? And almost like getting a diagnosis as a caregiver as a health condition, and setting up a treatment plan for them so that they can mitigate burnout or recover from burnout if they're already there is so important, because the whole system crumbles when the family caregiver's health and happiness is compromised.
Absolutely. And I don't think there is any amount of energy or resources that we could put into caregivers that would be excessive.
Right.
At the end of the day, it has positive ROI on the economy. We know the numbers. We know that people have to quit their jobs or start working part-time because of caregiving duties. That it does have a huge impact on the economy and on people's retirement savings, and the fact that we have so many family caregivers who reach retirement age with their resources depleted due to years
Yeah.
of caregiving. It
Yeah, it's
shouldn't be this
reactive.
way. Yeah.
Yeah, at least in the way it's set up in the States is like we are encouraging people to reduce their assets so that they can potentially get on a wait list for Medicaid services to help pay for long-term care. Like it sounds ridiculous when you say it out loud, but that's system. So we either have people paying, private paying, or we have the services, but most of the majority of people I feel like are in the middle where they need to kind of better understand how to financially access these things. So there are some tech services out there that help people navigate that too, which is amazing. Going through a wizard or a questionnaire of, do you get veteran benefits? Are you on Medicaid? And asking you different questions so that you can maybe access what's available. But still, sometimes the answers are not great there. Is there a way that we could donate our vacation time to other people or donate our miles easily to help a family caregiver go visit a loved one? I got ideas all day. Let's go. Yeah.
Those are amazing ideas. It never occurred to me that you could do something like that to support other caregivers.
Yeah.
Why not? I mean,
We're like, I'm sitting on all these miles, this and that. But then there's like somebody out there like, I need to go to, from Georgia to California is like $1,000 plane ticket. It's a lot. So to manage that. And so I think, there's GoFundMe's and ways like that, but is there other creative ways that we can support the caregiver community financially would be amazing. Probably the hardest problems, right, is care is expensive. How do we help people pay for this? How do we streamline it for them and make it easier to access some of these resources that are available to them? I mean, another big area I think for caregivers is respite. They desperately need breaks, but it is hard to get the breaks that they need. And there are some people that are doing retreats, but then you think, well, they've got to sometimes pay for the care behind to even go on the retreat. And so it's hard. It's a really hard problem to solve.
Exactly. Not to mention that you have to teach someone how to provide the care that you're providing for a 3-day
Yes.
retreat. I mean, it could really cause someone to not go to the retreat.
Yeah, we're doing a cruise actually in October called the Self-Care at Sea Cruise for caregivers. And that's one of the things that we've noticed is that it'd be amazing for them to come on a 7-day cruise, but it's hard for them to set up the system behind them that can be able to afford them this break that they need to go. And what I love about it, they come for the break, but they leave with the community because once they come on some of these respite trips, caregiver retreats before that have been life-changing, we know where you get a group of strangers to come together. And then through this shared experience of storytelling and being vulnerable, there's long lasting connections. They've got, support and resources, which is going to, help everybody that's involved.
Absolutely. So I have one last question. What are some of the technologies that you wish would be coming down the pipeline in, let's say, 30 years from now, when you and I are older and maybe we need caregivers?
Yeah.
What do you wish would happen?
Yeah. Well, honestly, I wish somebody would cook dinners for family. Can we get the robots to start making the dinners yet? Like I've certainly used ChatGPT to simplify meal plans, and one time it even spit it out, and I said, "Can you redo this so that I can just use my air fryer for everything?" But in addition to all of these extra responsibilities, we still have the day-to-day things that we have to do. So making these everyday tasks a little bit easier so that we have space for, and I think is important. Finding groundbreaking solutions to some of the big diseases and conditions are out there. Like that excites me. Like I would love in my lifetime to see cures and progress with dementia and cancer and some of the other things that are affecting families. I'm excited about, sometimes it's not even the big things, it's just like the little things, but I'm also a little bit cautious too in that, I have concerns about cyber safety and the AI I can't even say the word.
The deep fake.
Yeah, like I do have concerns about that. And I think we have to address some of those things as a society so that people feel more comfortable in stepping out of their comfort zone and trying different technology. I think my kids are obviously going to be more willing to try technology and try new things than even my generation is. I think there's a lot we can learn. Like even like the little things like my Aura ring, that excites me, is that like how accessible it is for me to get data about my well-being on a daily basis. Like that is amazing. And how I can make tweaks on a daily basis to make improvements there. So a lot of the wearables I think is exciting too, and fall prevention and better ways I think for communication. There's always in removing the barriers and allowing people, who are potentially nonverbal to communicate better. Those things excite me.
Absolutely. We definitely, it feels like we already sort of live in the future in
Yeah.
Star Trek episode. And I have no doubt in my mind that we will have robots making dinner for us.
The Jetsons. I see
It will,
it too.
it will happen. It's going to happen in our lifetime. I'm sure of it.
I'm
So
sure of
that
it
was
too.
that was actually my last question. Is there anything that we didn't talk about that you would like to add? Any call to action to our viewers or listeners?
I mean, get plugged in and get plugged into communities, get plugged into your resources like that you're offering so that we can be smarter, because when we know better, we do better. And it's going to help make this caregiving journey sustainable for all of us. And then just a shout out to my Atlanta AgeTech group. I love what they're doing. I love how they're scaling in different areas and bringing the information to our communities. I think I'd love to see more of that too. So big shout out there. And if anybody's interested in learning more about what I have to offer, I would love for you to check out happyhealthycaregiver.com.
Absolutely. Any caregivers in the audience should definitely check it out. It's a wonderful, wonderful resource.
Thank you.
Elizabeth, thank you so much for joining me on the show today. It was an absolute pleasure to finally meet you and to have this conversation.
Thank you. Thank you for the space to talk about this and to support and empower caregivers.
Thank you. If you found this conversation helpful, you'll definitely want to check out my conversation with Max from Giver, a startup that helps caregivers get paid. I'll put the link right here. Until next time, stay humble, stay curious,